Good day, I be to Dr. Nur Farahia Muhammad and Dr. Saidatu Arinawati Awang. Today we're going to present our assignment 2 based on a case study D. Before I proceed, I would like to introduce you to my fellow groupmate. My fellow groupmate consists of Anjingyi, Nur Zarifa binti Azmi, Nelson Mak, anak Kilotu, Nurul Zulaika binti Zafrul Imran, and Nomili Majinus. Our case study is about a bioprosthetic valve. Is an artificial heart valve made from porcine and bovine heart tissues. Calcification is the most common cause of damage and subsequent failure of bioprosthetic heart valve.
What is calcification? Explain in detail. Calcification is the accumulation of calcium in body tissue, blood vessels, or organs. This accumulation can harden and disrupt normal processes of body. As calcium is transported through bloodstream, calcification can occur in almost any parts of the body. Calcification are small deposits of calcium that show up on mammograms as bright white specks or dots on the soft tissue. Calcification can be in natural inflammatory response to infection, trauma, or autoimmune illnesses, as well as a protective response to harm. In this case, the natural stress on the valve from wear and tear can also cause calcification and degeneration of artificial valve. There are two types of pathological calcification. The first one is dystrophic calcification. It is when the deposition occurs in dead or dying tissues and occurs with normal serum levels of calcium and normal calcium metabolism. The second one is metastatic calcification. It is when the deposition of calcium salts in normal tissues and always reflects some derangement in calcium metabolism and increased levels of calcium.
So today I'm going to talk about 3 approaches to overcome this problem. The first method is by using inhibitory mechanisms such as traveler metal ions. Pre-treatment of bioprosthetic tissue with iron and aluminium inhibits calcification of subdermal implants, glutathione pre-treated porcine cups or pericardium. These compounds are thought to work by complexing the cation with phosphate, preventing the formation of calcium phosphate. Both ferric ions and traveler aluminium ion inhibits alkaline phosphatase, an important enzyme involved in bone formation which may be related to their mechanism for preventing calcification. Another mechanism is amino aldehyde acid. Through an amino linkage to residual aldehyde functions, 2 amino aldehyde acids bond covalently to bioprosthetic tissue. This prevents calcium flux through bioprosthetic cups. This compound is used in FDA-approved non-standard and standard porcine iotic valve. The second method is by reducing the concentration of glutathione. To reduce immunogenicity, bioprosthetic heart valves are fixed in glutathione. Fixation causes collagen cross-linking which masks antigens, resulting in reduced antigen presentation and chemical stabilization. It also causes membrane damage which leads to calcium influx. This calcium binds to membrane phospholipids, resulting in the formation of calcium phosphate crystals, crystal growth, and valve failure due to tears and stenosis in the presence of mechanical stress. In order to reduce these changes without compromising quality, the concentration of glutathione used has gradually been reduced to 0.2%. The third method is use of tissue fixation. It is a distinct set of strategies has been developed to avoid the use of glutathione entirely and instead employ other methods of tissue cross-linking. Cross-linking bioprosthetic tissue with non-glutathione compounds such as epoxy, carbonamides, acyl azides, and others has been shown to decrease calcification.
Conduct the biological evaluation of the bioprosthetic heart valves as part of a risk management process. The analysis should contain medical device categorization and biological evaluation tests required for the device. The medical device categorization. These medical devices are classified according to the risk connected with susceptibility of human body as well as the technical design and manufacture of the device. It employs a set of classification rules based on the intended use or regulatory controls necessary to give reasonable assurance of safety and effectiveness. The medical device categorization divided into 2: nature of body contact and contact duration. For nature of body contact, it used for implant medical device. Application site is blood. Medical devices principally contacting circulating blood in the cardiovascular system. For the contact duration, it used for long-term duration. Medical device whose cumulative sum of angle, multiple or repeated contact time exceed 30 days.
Next is biological evaluation test. The goal of a biological evaluation of a medical device is to verify that it is safe for both patient and user from a biological and toxicological standpoint. Preclinically, either by in vitro or in vivo procedure, and maybe on animal models, a set of tests are performed with the support of international standards to assess the biological safety of the medical device as part of the risk management process. There are several biological evaluation tests. First is cytotoxicity. It refers to ability to be toxic to cells. And then second is sensitization. Sensitization is the immune system's reaction to chemicals. Next is irritation. And then intracutaneous reactivity, hemocompatibility, material-mediated pyrogenicity. And then other than that, there's also acute systemic toxicity, subacute and subchronic toxicity, and then chronic toxicity, implantation effect, genotoxicity, and also carcinogenicity.
The last part of presentation is whereby imagine that you're a junior biomedical engineer responsible to develop new bioprosthetic hardware, propose main components or parts, and design consideration for this device. Design consideration should include chemical, morphological, and mechanical properties of the biomaterial that will be used for the device. For the leaflet, it has to be porcine iotic valve or bone perigal tissue fixed by stabilized glutaldehyde. For the stent, polypropylene stent covered with Dacron, alkyloid wire covered with porous knitted Teflon cloth. For the suturing, Dacron, soft silicone rubber insert covered with porous Teflon cloth. For chemical properties, it should be bioactive and non-toxic. It should be corrosion resistant, biocompatibility, bioadhesion, biofunctionality, processability, and availability. It also should have lesser issues with platelet adhesion. For the morphological properties, when compared to smooth surfaces, rough surfaces have large surface area in contact with blood. As a result, coagulation occurs at faster rate. For the mechanical properties, it has flexibility where able to sustain deformation at low stresses and quickly return to their original shape. It has to be tough, where able to absorb energy up to point of fracture. It also has to be resilient, where able to absorb energy when deformed elastically and recovering this energy upon unloading. That's all from us. Thank you. Have a nice day.